starting with these 4 cases, 4 different pictures, A, B, C, D. So which of this is a melanoma and which is a nevus? So basically this is an amalgamation of whatever teaching that you heard over the last 1 hour from all these 3 eminent speakers. So I think you should be in a good position to answer this. A, B, C, D, which is a conjunctival melanoma? C. Okay, so of these 4 pictures, all are conjunctival nevus. Okay, so the picture A, there is prominent feeder vessels, but any conjunctival nevus up to 35% can have feeder vessels. Intrinsic vessels can be present in about 32% of the cases. And this particular nevus, which has a variegated pigmentation, some of them can be lightly pigmented, some of them can be darkly pigmented. And corneal invasion is basically seen in up to 1% of the conjunctival nevi. And deep pigmentation, what you probably guessed as a conjunctival melanoma, is very common in Indians, where as a race we are dark complexioned. Okay, so multiple lesions is seen in 5% of the individuals. Bilateral lesion can be seen in 1% of the individuals. So based on just presence of just few features, you can never differentiate whether this is a nevus or it's a melanoma. So basically, you must always decide whether it is a melanoma or a nevus based on 5 features, that is age, history, thickness, size and the number of feeder and intrinsic vessels, and the presence of cysts. Cysts is present in 63% of the nevi as compared to melanoma, where only 5% of the lesions can have cysts. Okay, so following the same protocol, this middle-aged gentleman who gives a history of prior excision therapy, excision biopsy, what is this lesion likely to be? Okay, so it's a middle-aged gentleman, there is a history of prior excision, definitely there is some thickness to this lesion, lot of feeder vessels, angry looking, and a bunch of intrinsic vessels as well. So the likely diagnosis is conjunctival melanoma. That's right. So conjunctival melanoma can also be just dark complexion, like these 2 cases where there is no intrinsic vessels, no feeder vessels, just a very darkly pigmented flat lesion without much thickness. But even in conjunctival melanoma, there can be 2 different types of diagnosis, like we have in case 1 and case 2. What is the difference between these 2 cases? Very similar looking, but there is a difference, a big difference. No. So the first case you see is a de novo conjunctival melanoma without any surrounding pigmentation, as you can see. In this second lady, this is a melanoma that is arising from a pre-existing PAM with atypia. So you can see that there is surrounding pigmentation, and this lady gives a history of pigmentation that was present since many years, and suddenly the pigmentation started to increase and grow, where retrospectively you can diagnose it as conjunctival melanoma that is arising from a pre-existing PAM. Okay, now this is a very intelligent adult patient who came with me, and in his very first visit, he came with a couple of pictures from his childhood. What he said is, since childhood, he had a small pigmented lesion, and this is how it looked like. And during teenage years, it grew bigger, and at the time of presentation, the pigmented mass was more reddish and, of course, much larger than the original pigmentation. So what is this? It's a conjunctival melanoma, all right, arising from a pre-existing nevus. Okay, so what you must remember is, anytime you see a nevus, the chances of it turning into a melanoma is very rare. It's less than 1% in Caucasians, and even lesser in Indians, but there's always a chance, so always have a lookout of it and keep the patients on follow-up. So this is a patient again with a very small pigmented lesion in the caruncular area with repeated history of bleeding. Looking at the size, and it's quite a young patient, about 18-year-old patient. You wouldn't think of melanoma, okay? What you would like to think of it as a congenital nevus, but there's a repeated history of bleeding. So for this reason, this lesion was excised, and it turned out to be a melanoma, a very small melanoma, which was a low-grade melanoma. So never forget to take the history properly. So now this is a lesion which is, of course, there is some whitish part, there is some blackish part. So what is this? Is it a melanoma or what is it? Any of the fellows at the back? Perfect. Yeah. So this is pigmented OSN. What you cannot miss out is the presence of keratin. There is a conjunctival mass which is pinkish. On the left side of it, there is a dark pigmented part, and there is definitely this white keratin mass. So what you must remember is pigmented OSSN is present in Indians, and 5% of OSSN can present as with some pigmentation. So please do not just directly go to the diagnosis as a conjunctival melanoma. So this, there should not be any doubt. This is a, what is this? This is a white big mass. No? So what is this mass? Is it a conjunctival mass or? So basically you can hardly see the conjunctival mass as such, but the keratin production is so much. The lesion is completely covered with keratin, with angry looking feeder vessels going into the conjunctival mass. So this is an OSSN with a big chunk of keratin. Okay. So what is this lesion? No doubt with this. What is it? What color is it? Red, yellow, orange? A salmon patch? Okay, yeah. So this is a marginal B cell lymphoma. So whenever you see a conjunctival lymphoma, always, especially when there is no discernible posterior border, always do a orbital imaging. So when I did the orbital imaging of this patient, what I saw was that there was thickening of the superior rectus. So basically this was an orbital lymphoma with a spillover into the conjunctiva. Of course, the patient underwent systemic evaluation as well, and the mediastinal and retroperitoneal lymph node involvement was seen. So the patient was treated with systemic chemotherapy and orbital radiation, and the patient is doing well. So what is this lesion again? Again a salmon patch with a feeder vessel. Yes, so this is a salmon patch. Again, it turns out to be a lymphoma. Again, on imaging, there was enlargement of the extraocular muscle, but however, the systemic involvement was not seen. So this patient was only treated after incisional biopsy, only with orbital radiation. Systemic chemotherapy was not necessary in this patient. So again, this is a patient with again a salmon patch with some amount of thickness. Again, it was B cell lymphoma of the conjunctiva. However, there was no orbital involvement, no systemic involvement, hence the patient was only treated with excision biopsy. There was no need for any chemotherapy or radiation. What is this lesion? Is this red, yellow, salmon looking? What is this? Is this salmon? I don't think so. And what is the kind of the pattern of vessels that is present there? Hairpin vessels. So this is a reddish lesion with some hairpin vessels. What is it most likely to be? Yeah, OSSN is a definite differential diagnosis, a papillomatous pattern, but this is a very benign conjunctival papilloma. Okay, yet another shiny reddish lesion with some feeder vessels in the conjunctiva. What is this? This would be difficult to guess, so I was not very sure of what this lesion might be. So after an incisional biopsy, I found out that this is an excisional biopsy, I found out that this is an IgG4 related conjunctival mass, and excision biopsy treated the patient completely. There was no adjuvant therapy necessary for this patient. This is unmissable. What is this? Yellowish lesion. This is a limbal dermoid. What is this? Lipodermoid, of course, it's again a variant of dermoid. What is this? Again a yellowish lesion, but it's an orbital fat prolapse. Again, this is a yellowish lesion. What is this? What is the difference between this yellowish lesion and this yellowish lesion? No, but there's a difference, right? The characteristic, you see, how is the conjunctiva over the fat looking? This is definitely angry looking, right? Lot of blood vessels. Okay, so this turned out to be a primary. Exactly, yeah. So Dr. Fairuz made a very good point here. So here you cannot see the posterior edge that well. Here you can see that there is a proper posterior edge. So this is basically a conjunctival mass with an overlying bunch of angry blood vessels. So this turned out to be a primary liposarcoma of the conjunctiva that was treated with excision biopsy and orbital radiotherapy. This Very good. So I included this picture to show that pyogenic granuloma can look vascular like this or completely fleshy like this. So please have the differential diagnosis of pyogenic granuloma in any of the conjunctival lesions that you may see. And what I think this is one of the last cases. Okay, so what is this? A reddish lesion? Varix, yes. So orbital imaging is always necessary in a patient of varix to see how much of varix is present in the orbit itself. And to my surprise, on this orbital imaging, I found what is this? What is this hyperdense lesion that you see along the inferior floor?
Phlebolith.
It's a phlebolith. Okay, so it's basically because of stasis of blood within the varix. Sometimes there is occurrence of a phlebolith like this. Okay, what is this? This is the last case.
Nevus sebaceous.
Perfect. Who was that? Sir, aap the kya? You just want to finish this session, don't you? Okay, so Dr. Vikas has been right here. Yeah. So this is bilateral choristomas that the patient has. But what you must remember is when there is bilateral choristoma, patient, you have to look out for some hamartomas in the face, in the scalp and the neck region. So on examination, this patient had some amount of scarring in the conjunctiva, but on prodding a little bit more, he presented with his childhood picture, which had this typical nevus sebaceous of Haddowson. Okay, so in a patient with nevus sebaceous Haddowson, you always look for choristomas in the conjunctiva, which is usually bilateral. Okay, so yeah, this is post-operative. Yeah, thank you.